Joining us now from New York is Dr. Dean Hart. And Doctor, I guess the easiest way to put this is you have found now that coronavirus, COVID-19, is also affecting our young children in unique ways. What did you find?
Well, there's a little bit of this unique disease that seems to be an autoimmune disease, we believe. It's called Kawasaki's disease and affects the arteries, blood vessels, and even the heart of very young children, generally under 5 years old. All of a sudden, this disease you might see once a year at most is becoming maybe 2 or 3 times a year. It's not that huge, but it is significantly more present, yet it's still in the very rare category in these young children. And there seems to be an association perhaps with COVID-19. But this Kawasaki disease, if it's treated, it's usually cured. So it's something that's going to drive every parent crazy as soon as a child gets the fever. But the fever alone, I wouldn't go so crazy because you get other things like, the eyes can be beet red without excretions. The hands can be swollen. The feet can be swollen. The tongue can be swollen. There is something else going on you usually see with Kawasaki. But if you're not sure, the doctor can definitely tell you, because everybody is looking out for it right now, because all of a sudden something you never even knew about as a physician is in the news, so you want to read about it and you're tuned in.
Dr. Hart, you live in the age and the era of Dr. Google, of which I know all too well. I have my 2-year-old granddaughter living with us. So you described what the real symptoms are, but I think one of the things that you need to talk to parents about is that we're still learning about this particular virus, because at first we were told that younger children were not going to be affected. Now we're finding out that younger children are being affected. What do we know about this virus in children?
Well, there's lots we don't know, with great questions all over the place, with a paucity of answers, like you said. And we're only slowly getting answers because science is not on a time clock. Science takes a long time to find out the facts, and it does a very good job given enough time. When COVID-19 came about, N is for novel. Nobody's ever experienced it, so we're collecting data and crunching numbers. We still totally believe the mortality for 30-year-old individuals, the COVID, and younger, the mortality rate super low. The odds of them getting over it without hospitalization, without anything but drinking plenty of fluids, and maybe put a Tylenol, a children's Tylenol if they're really young, they get over 98, 99% of the time. So this Kawasaki thing could be 0.0001% of the cases, something bizarrely small. Now, it's enough that if I had a 5 or younger child and they had a fever, I'd go to Google and look up all the list of the things it could be. Rash near your genitals, they won't mind at 5 years old. So you look at all these things and you see if you got any comorbidity, signs and symptoms that are related to it. But a fever alone, even if it's COVID, kids have a very good immune response and cure it. And usually kids don't even know they had it.
Children can be asymptomatic with coronavirus. They get over it because their immune systems are on hyperdrive. But that means they could be rather contagious to grandma and grandpa.
Well, we call it hyperdrive. Hyperdrive causes that Kawasaki problem. So you want strong immune response and for it to go away when you've killed the virus. In many cases, grandpa and grandma or mom and dad get these immune responses that don't go away, and they like lupus and other diseases like rheumatoid arthritis, you can get diseases induced by an overactive immune response. Now, a proper immune response that's very strong and knows to go away, that is the goal. And kids have a very strong immune response to go away. When they clean up the virus, heck, they dirt out of the potato fields. They're used to these things. So when the child gets COVID, maybe a quarter or a half may be asymptomatic. And the biggest risk to letting children go back to school is not them getting COVID and hurting themselves with some rare, unique outcome. The big problem with opening schools for the children is it's a perfect incubation site for these asymptomatic, or maybe they got a fever for a few days and it goes away. These people are able to then contaminate people, where these little people, these young children or teenagers, adolescents, they're able to communicate to adults who aren't as great immunologically. As we go along in life, at about 40 years old, our body heads towards senescence. So the immunological system takes care of it really well in almost every children. It's very rare they don't kick the virus right out, like gobble it up, kick it out.
You raised that interesting point, which is that now we're having this debate about how we can possibly reopen society, how we can reopen our schools. From a physician's standpoint, somebody who has spent their lifetime studying diseases like this, how much do we really know about this virus when it comes to small children who we may be sending right back out into what I have always described as a parent and a grandparent as the world's largest petri dish?
Well, I couldn't agree more. This is the great risk, because it's really a bioethical decision. Children have to learn. We know that. It would ruin them to not go to school and be educated. There's no future generation with that scenario. On the other hand, we send them to school and they come back and kill off between 30 and 65, some people die. After 65, especially the comorbidities of obesity and or high blood pressure, cardiovascular disease, a large chunk of those people are not coming home and get on a ventilator. Now, that's a small percent of overall society. Now we have the bioethical conundrum. Do we destroy the economy, destroy the education of a young person, but save millions of people's lives because we're locked down for eternity? And obviously, neither are good choices.
I want to go back before we end this interview. We got about a minute left, and I want to make sure that parents understand. Little Johnny and Janie, when they're cutting a tooth, they get a fever. When they're getting a cold, they get a fever. What type of fever are we talking about that they should be concerned about? Not just the one that all of a sudden they check Johnny's temperature and off to the emergency room they go.
Yes, so we know children get temperatures frequently in an average year. So that's nothing to be surprised about. The two things that are most concerning: little kids, little people, don't have the same cooling mechanism as adults. Little people are not little adults. They can't cool the body. So 102 or 3 becomes the point where you have to get a child cooled off, or they could go get sterile from that kind of temperature. So, and then the amount of days in a row matter too. If you have 101 for 2 days, I give them Tylenol and hope for the best. But if you have other things going on with the body, then I would take them to the urgent care center. And if it's over 102, we got 103, that's just not acceptable to a little person's body. They can't cool off so well. So sometimes they give you an ice bath. There's all sorts of treatments, but I'd like a doctor to see a patient if they have 103 fever and they're under 10 years old, even 15 years old, somewhere in that range. 103 starts to really worry a doctor, and 101, that's in the range of a cold, can give you 101 for a day or two. As long as there's nothing swelling, the eyes aren't all beet red.
We will be on the lookout for this, and I'm glad that you gave us the information, because we are learning so much every day about this particular virus and how it affects not only our seniors, our minority populations, and now it appears our youngest as well. Dr. Hart, thanks for being with us.
Oh, you're very welcome. We will learn about it. Just time, but science cannot be put on a time clock, and we need to do that in this case, and it doesn't do it.
Dr. Hart, thanks.